Hello, everyone. Welcome to Livongo at Home. I'm Glenn Tallman, Livongo's Executive Chairman and Founder, and I'm broadcasting to you today from Chicago, where I'm sheltering at home and doing my part to flatten the curve. Today is World Health Day, and with everyone in the world focused on health, there's never been a better time for all of us to focus on what we can do to stay healthy. And of course, we're all impacted. Our hearts go out to those people who are dealing with COVID-19 directly, and our pride and admiration go out to those doctors, nurses, and other health professionals who are caring for them. But many of us have a role to play in this, whether it's at work, whether our families are impacted, or whether we're dealing with stress and anxiety for what comes next. And I'm here to tell you that we'll all get through this, and we'll all get through this together. But also things will change in the future, whether it's the way we do education, and we've seen the power of digital education, whether it's commerce and how we buy things, and many of us are getting our groceries delivered at home today, whether it's the way we communicate, like we're communicating today with Zoom or other technologies, and most important, our health. And I believe that what we'll see is some dramatic changes in health. When we first started Livongo, our goals were to empower people with chronic conditions to live better and healthier lives. And what that meant to us was focusing on people, some of the most vulnerable populations, people with diabetes, with hypertension, with weight management issues, and with mental health issues. And the idea was to make it easier for those people to stay healthier and to actually meet them where they are. And today, with the arrival of the coronavirus, what we're seeing is we need to accelerate that progress. And while people with chronic conditions are no more likely to contract COVID-19, if they do, they're at a much higher risk. In fact, the recent CDC study showed that 78% of the people in ICUs, in fact, had a pre-existing condition. We need to keep the people with chronic conditions away from physician offices, away from clinics, away from emergency rooms, and away from hospitals, because that's the most dangerous spot for them. So more than ever, we have to use remote monitoring, telehealth, and other technologies to deliver them the ability to stay healthy, to stay informed, and to actually use these tools to deliver better health care in a more convenient and easier way. So there's no better place to talk about it and no better time to start than today. And over the next 60 minutes, we'll introduce you to a number of experts who will inform you about COVID-19, ways you can stay healthy. And at the end of our program today, Dr. Jennifer Schneider, our president, will actually introduce some tools that will become available to you to help you deal with many of the issues surrounding COVID. So enjoy the program, and to take you to the next steps, I'd like to introduce our Chief Marketing Officer, Courtney Westendorf.
Thank you, Glenn. I'm Courtney Westendorf. I will be your host today while sheltering in place here in Washington State with my 2 daughters and a few friends. I wish to start by welcoming all of our guests today, including our Livongo members, to our first World Health Day online event. I want to thank our presenting sponsors, Health, the American Diabetes Association, the American Heart Association, and the American Medical Association. These are all amazing organizations doing incredibly important work to ensure our safety, health, and information during these very challenging times. I cannot say enough about each organization and what they are contributing to our communities and to our country. You will hear more about their work over the next hour. But first, we have a very special guest joining us today. Sean DaCosta is a Livongo member living with diabetes and hypertension. A truly delightful person, we are pleased to welcome Sean to talk to us about how she, living with chronic conditions, is doing during this time of the COVID-19 pandemic.
So hello everyone. My name is Sean DaCosta. I am 53 years old and I live in Houston, Texas with my family. So I'm a mom, I'm a daughter, I'm a sister, I have lots of coworkers, I'm a friend, and I'm also a pet owner. I love to exercise. I love running. I love touring my neighborhood, and I just love life in itself. Managing diabetes, it's not super easy. It's a process that you have to kind of get used to. So before this whole corona pandemic, I was managing it by, I guess staying on a schedule. So I have my routine where I get up in the morning, I take my pills, I check my sugar, I check my blood pressure, and then that pretty much sets the pace for how I'm going to continue with the rest of my day as far as what I'm going to eat, what I'm not going to eat, and that sort of thing. So that's basically how my day starts and how it follows through from the time I get up to the time I repeat. What has changed since the global pandemic? What has changed for me? The fact that I can't really go to the places that I'm used to going, and I'm not free to visit, friends and family like I would. So mostly I am at home. And so I guess that's the biggest change. I am still working. I'm working 3 days a week, and I am at home 2 days. What I'm doing at home now that helps me, I find a lot of things that I am interested in and I like doing. So I plant a lot. I'm doing my little herbs. I do a lot of DIY. I am cooking a lot more, creating my own recipes, and just finding little projects that keep me busy. So prior to all of this, my family and I went out and kind of bulk purchased supplies and food, things that we would need just in the event we wouldn't have that opportunity. So we are pretty stocked up with what we would need for a while. As far as my medication, and I actually had gotten sick a few weeks ago, not the coronavirus, just a head cold, and I was able to do a e-visit with my physician. And so that worked out really well, and I was able to get my prescription. So my prescription is called in, or they would remind me if I have a refill, something that needs to be refilled, or, and then I would just go to the drive-through and pick it up. Right now, everything is just going okay, so I'm really not worried much. I worry about if something happens to my car and I can't go somewhere because the mechanic shop is closed, but I'm not worried about my medication. I'm not worried about that right now. When I was initially diagnosed and I was not able to get the medication I needed to because I couldn't afford it, it was a problem. But right now, I don't stress about that. I find that I have more time to work out. I plan my day. I plan, I set goals. I'm setting goals now, and I'm just pretty much going one day at a time. I'm really not at the point where I am stressing. Some of the advice that I would like to give to others, like especially people that are in my position, is to be hopeful. Be hopeful. Accept the love from the people that you're surrounded by. Be faithful. Know that this is not going to last forever. Find things to do. Find things to do that will occupy your time, that will make you happy. Challenge yourself. Set goals and challenge yourself to be better tomorrow and the next day and the next day. Read books, play games, do a lot of research. You don't have to be alone. You don't have to feel alone. We have so many things around us that can, that would help us to just overlook all of this that's going on right now. We can do this. I just wanted to say thank you guys for allowing me to be a part of this today. This was really great. It's really really tough time for us, and I'm really thankful for family, friends, and loved ones. I'm thankful for my Livongo coaches because I can reach out. In addition to my family and friends, I can reach out to my coaches. It's been wonderful. This could have been so much worse, but I am really thankful for my faith, for knowing that God is there in time of need, and for the hope that I have. Thank you guys so very much. And I wish you all the best, and I wish everyone stays safe.
Thank you for sharing your story with us, Sean. And please keep up that energetic spirit and be well. I am pleased to now connect us with Tracy Brown, Chief Executive Officer of the American Diabetes Association, the nation's largest voluntary health organization and a global authority on diabetes. Ms. Brown?
Thank you, Courtney. I'm so excited to be spending time with you all today. Thank you.
So Tracy, can you tell me a little bit about your sheltering in place now? Who are you there with? How are you keeping yourself busy? And really, what are you doing to stay connected with others during this time?
Yes, so we find ourselves in an interesting time right now in this COVID-19 crisis. And like many of you, I am pleased to actually be home in the sense that this is allowing me to spend more time with my family. I am sheltering in place and looking for the silver lining in all of this. I have a wonderful husband and a beautiful 16-year-old daughter. And we are all adjusting to our new normal. And one of the plus sides is my daughter is a competitive dancer. She's been dancing since she's 3 years old. And because all of the dance studios and competitions are closed down, she's been dancing downstairs in our basement, and I have become one of her students. So my dance moves have gotten a lot better in this quarantine self-sheltering space. The other thing is, just as everyone else probably is, I am staying connected with my family and my friends with the use of technology. So now more than ever, if people weren't up to speed on technology, they are quickly up to speed now. And so I use all of the ways that I can actually connect with my family and actually see each other using the plethora of tools that are out there. So again, interesting times for everyone, but we are all making the best of it here in the Brown household. And we live here in Vienna, Virginia, just outside of Washington, D.C.
Is COVID-19 more likely to infect those of us with diabetes? Or is it that we would have a more difficult time recovering from the virus if infected?
So yes, so you know, I've been living with diabetes myself for the last 16 years. And this question around whether people with diabetes are more at risk for contracting the virus and or the complications being worse. This is one of, I think, the key questions. And so what I will say is, let me just start from a science perspective first. So the American Diabetes Association, as you can imagine, have been very deep in trying to study and analyze all of the research related to the connection between COVID-19 and those of us living with diabetes. You know, I was just recently talking to our president of science and medicine from the ADA, Dr. Bob Eccles, and here's what we know, that there is not enough evidence or science out there, either coming from the other countries and or the United States, that suggest that those of us living with diabetes actually are at a higher risk of contracting the virus. The data does not prove that out right now, the data that we have. What we do know, though, so everyone has equal a chance of contracting the virus. What we do know is that if someone with diabetes does contract the disease, there is a higher risk that the outcomes that you will face will be horror, meaning the outcomes of what you experience in terms of complications will be or have a chance of being worse.
Tracy, what should people with diabetes do to minimize their risk and to continue to stay healthy?
So people living with diabetes should, in order to minimize their risk and stay healthy, should do the things that we all should be doing as we think about thriving with diabetes. But first and foremost, is prevention. Avoid contact, right? So number one is do everything that we need to do to prevent contracting COVID-19. All of the things that we have been talking about, practicing the social distancing, making sure that you are not touching your face, your eyes, washing your hands, and now most recently, wearing those cloth masks, man-made masks. So first and foremost, do that. The second thing is, maintaining healthy and normal controlled blood sugars. That is paramount into keeping people living with diabetes healthy and thriving, COVID-19 or not. I have myself been doing a great job of trying to stay on top of my own blood sugars, particularly in this sheltered in time, and thrive while I'm living with this disease. And I will just quickly show you, I wear a continuous glucose monitor myself, and I don't know if everybody can see this, but my average blood sugars over the last 90 days has been around 89. When you are maintaining well-controlled, healthy blood sugars, that is defense number one against COVID-19 and anything. Then, of course, there are the other things that we need to keep in mind. One is very mindful of the food that we are eating and ingesting in our bodies. Two, your level of stress. Stress affects your blood sugars, how you are sleeping, maintaining good sleep habits, and then movement, exercise, how you're actually moving your body and getting that physical exercise. So those would be the things that I say, those of us living with diabetes, be mindful of those. Prevention, follow all of the social distancing and the washing your hands, managing healthy blood sugars, managing what you eat, how you move your body, how you're sleeping, and your stress. Those are the key to living successfully and healthy, COVID-19 and beyond.
What are some of the things that you are finding that you, while sheltering in place, are making for food? What food choices are you making? And what are some of the things that you're finding you're making at home or you're having delivered?
So some of the things that I am enjoying in this sheltered in space, I hate to even admit it, but my husband is a much better cook than I am, and he usually does all of the meals. But in this shut-in, sheltered-in place, we've actually been cooking together. And I am, a lover of ribeye steaks, a lover of lean chicken, lean fish. And so we've been doing lots of proteins with lots of green vegetables. And again, the beauty for all of this is that we are in the kitchen cooking together.
Tracy, how concerned should I be, a person living with diabetes, when I actually go out of the house?
I think when leaving the house and how concerned someone living with diabetes should be, I have just been following the science and the data and the authoritative folks in this space. So we have all heard, particularly over this past weekend, Dr. Tony Fauci, the US Surgeon General, and the data from the CDC that talks about, us coming on to what would probably be one of the worst weeks as it relates to the COVID-19 virus. They've also been talking about this notion of, the asymptomatic folks walking around with COVID-19 and not even knowing it. And so the most recent guidance was around using a cloth mask, and many have been showing on the internet ways to make these masks. In fact, the US Surgeon General showed how to make one as well. I personally am taking all of those same precautions, again, as someone living with diabetes. And so when I go out, I do wear a little cloth bandana. And I think just out of an overabundance of caution, we all should be following those. Again, a person living with diabetes, we want to do everything as possible to avoid being in contact or getting the COVID-19 virus.
What support is available for people living with diabetes?
There's all kinds of support available for people living with diabetes. I'm going to, share a few resources as it relates to what's available from the American Diabetes Association. I think everyone knows that our only reason for being is to fight for those that are living with diabetes. We want to help all people thrive while they're living with this disease. And so there is a broad set of resources. I'm going to start just with our diabetes.org website. And on that website, there is a COVID-19 special landing page that provides you with all of the resources, many of which we've talked about today, of things that people living with diabetes should be doing. The other thing is we know that insulin and getting insulin and the medications that people living with diabetes need to live, things are getting very constrained. Pre-COVID-19, we know the cost of insulin and diabetes medicine was already high. In these times where people are unfortunately losing their jobs, this is a extremely important issue. And so we have a site called insulinhelp.org. If anyone living with diabetes needs help of any kind as it relates to getting your insulin or other diabetes medications, please, please, please go to insulinhelp.org. We do not want anyone actually having to make a decision on whether to put food on their table, a roof over their head, or buy the medication and insulin that they actually need to live. There is help, and go to insulinhelp.org. The other thing is, during this COVID-19 time, we are working very hard from an advocacy and a legislation perspective. We know that things like trying to zero out the copays required for insulin is something that would be an immediate help for people living with diabetes. We are pushing to have continuous healthcare coverage for the people living with diabetes who unfortunately may be losing their jobs. We want to make sure that they continue to have health coverage. So we're going to continue to push there. We know that there are also some administrative burdens as the healthcare system has gone to telehealth and telemedicine. There are requirements such as needing to fax in medical records and blood lab work and all of these things in order to get your medication, in order to get refill of your supplies and CGMs. We have been working to change legislation and get emergency waivers to remove all of those barriers. And so what I will say is we also have stood up an engagement platform, because we want to harness the voice of the millions of people living with diabetes and all of those who love and care for us to help us drive these very important legislative changes. So you can simply go to diabetes.org/engagement platform. And there you will see the top pieces of legislation that we are trying to immediately get passed. And in a 30-second click of the button, you will be able to fire off the emails to your congressmen and women to help us drive these changes. We've also sent letters to every governor actually driving for these important changes as well. So that's another. And then the last that I will say is around mental health. Okay, so in this crazy COVID-19 time we find ourselves in, there is a higher level of anxiety, and there is a higher level of stress. And we want to make sure that people are actually managing their mental health. This is so important. Also affects your blood sugars. And this is a natural, normal feeling for people to feel a bit of anxiety and stress around this right now. And so that is okay, but we are going to actually stress that people do the right thing to provide themselves with good mental health. And so you will see on our diabetes.org website, we have a section around mental health, and we also have a couple of videos that we're going to continue to push out. And so what I will say is, I just want people to know you are not alone. You are not alone out there in what we are doing. People living with diabetes already carry a heavier burden. We already have hundreds of decisions that we are making every single day to manage and thrive with this disease. Know that you're not alone, and there are resources everywhere. Don't hesitate. Call us, 1-800-diabetes.org. Go to the website. We're here for you. The message that I will share in closing, during this COVID-19 time, I mean, I think that what we all should know is that we need to work together. We need to be together. Now more than ever, humanity must rise up for us to actually defeat this COVID-19 crisis and emerge out of this thing stronger and better. And I want people to know that they matter and that they're not alone. And that together, I am so confident in this, that together we will actually move through this thing. That I am prayerful that we will look back on this time of COVID-19 and we will be proud of how we as how humanity has come together yet again to rise up and above and make us all stronger and better.
Tracy, thank you so much for sharing this important information for such a large segment of our Livongo family and today's audience. We wish you and your loved ones health and wellness during this entire situation.
Hi, I'm Congressman Ami Bera. I'm also a physician, and just like everyone across our community, our country, and this world, this novel coronavirus, COVID-19, has affected all of us. Many of us are having to stay at home, and that affects both our physical health as well as our mental health. And when I think about this and how it affects us, it's really important for us to take care of one another. It's that human kindness that will get us through this. If you think about the fact that we've seen crisis before, we've seen tragedy before, but it usually affects one part of a country or a world. This has affected all of us at the same time. So we're in this together. And if we stick together and we look after one another, we will also come out of this stronger, kinder, and more resilient. Let me put my doctor hat on and provide some points on how me and my wife Janine and our daughter Sidra are caring for ourselves. One, we've noticed that we're spending obviously a lot more time together. We're eating healthier, trying not to snack as much and take care of our physical health. My wife and I have started to go on daily walks, practicing social distancing and being mindful of others that are out there. But part of physical health is also to get outdoors. And we've been blessed here in California to have some sunny days. So getting outside and that human connection and going for those long walks is actually a great way to help our mental health and our well-being. Another thing that we're doing, with my extended family tonight, we're going to have a Zoom trivia night party. My dad is 86 years old and lives by himself. And this is a great way for him to connect with his children, his grandchildren, and for all of us to, via teleconferencing, be able to be together. And things like that are also incredibly important for our mental and physical health. Lastly, for those folks that may have a chronic illness or a chronic condition, this virus has really been impactful to that population, especially if you're a senior American over the age of 60 or a senior citizen that has a chronic illness. For that population, we all have to do our part to make sure they're safe and healthy. You've seen that the CDC has now made recommendations that if those of us that are low risk and asymptomatic, we have no symptoms, but we're going out to do an essential activity like pick up groceries for a neighbor or for ourselves, we should now start wearing some kind of a face covering. Whether that's a formal mask, although I would advise let's not go out and try to get those right now, so our first responders, our healthcare workers can have the formal masks available for them. But it could be something as simple as a bandana or some kind of face covering. The reason why that's so important is while I may not have symptoms, we know that this virus can continue to spread even when you're not symptomatic. And while it might not make me sick, we don't want to get others in our community sick. And that's what I mean by all of us staying in this together. The second thing is the most important thing that we can do to impact and get past this virus is to follow those stay-at-home orders. That really is critically important. Even again, if you're a 20-year-old, you're at low risk for getting sick yourself, we want to make sure we don't infect anyone else who's at high risk. And if we do this together, if we stay at home together, we will get out of this much quicker. It's my hope that, as we go through this crisis in our country and across the planet, we realize that we're all connected together. We're all in this together. And when we come out of this, hopefully we will realize that the world is an interconnected place. Certainly in my day job as a congressman, I do hope the politics of divisiveness and everything else, we realize that, today we're all Americans and we're all inhabitants of the planet Earth. So be safe, be kind to one another, and be well. And we will get through this if we're looking after one another. Thank you and have a great day. Be well.
And now we're going to hear from Dr. Robert Harrington, who serves as the president of the American Heart Association. He is a world-renowned interventional cardiologist and clinical investigator in the area of heart disease. He also serves as the chairman of the Department of Medicine at Stanford University. Dr. Harrington?
Hi, my name is Bob Harrington. I'm a cardiologist, a professor of medicine, and the chairman of medicine at Stanford University. I also have the privilege this year of serving as the president of the American Heart Association. So I work in Stanford Medicine. I'm the chairman of the Department of Medicine there. And consequently, I'm overseeing a lot of the physicians and clinicians and staff and trainees who are on the front lines. Primary care, hospital medicine, intensive care medicine, a lot of the subspecialists, cardiologists, cancer specialists, infectious disease specialists, they're all in our department. And so I'm working daily from my office on campus in Palo Alto at Stanford University. and trying to help coordinate Stanford's response to the COVID epidemic. But I also have the other side of my life, which is my personal life. I live in Portola Valley, a small community about 8 miles away from the Stanford campus. And we are also sheltering in place with my wife and 2 of my 4 daughters. One daughter lives in San Francisco and works for Airbnb and came home to shelter in place at our house as her company closed its doors for the time being. And her younger sister is also with us. She's a graduate student at Stanford and moved out of the dorms. So the 4 of us are trying to work in the house. My wife is one of the directors of the Stanford Physician Assistant Program, and so she's teaching online in the master's degree course to her students. And my graduate student daughter is taking courses, and my daughter is, the other daughter is working every day trying to do her job. We're trying to take care of each other, trying to stay safe, and paying attention to all the recommendations coming out of the public health community. What we know about COVID infection is that people who have a variety of chronic conditions, high blood pressure, asthma, diabetes, heart disease, are at an increased risk of COVID-19 infection, and they are at an increased risk of complications of that COVID-19 infection. We know that from the data coming out of China. We know that from the data coming out of Italy. And we know that from the data coming now increasingly out of New York City. So people who have chronic conditions really need to take special care and precautions during this time of shelter in place, social distancing, taking care when one goes out in public. Wearing a mask is now the latest CDC recommendation as of late last week. Really try to take very careful attention to your surroundings and the kind of situations you're putting yourself into. An interesting question that's arisen is how do people with high blood pressure, how do people with asthma, how do people with other cardiovascular conditions, how are they at risk? And one of the most common questions that we're asked from an American Heart Association perspective is, what about the treatments that I'm on for my high blood pressure? Does that put me at increased risk? Things like the ACE inhibitors and the ARBs. We don't fully yet understand why it is that people with certain medical conditions have a higher risk from this particular virus. We know that generally people who have chronic conditions are at increased risk of complications of a variety of viral illnesses, including influenza. There's some particularly interesting aspects that we're learning about the COVID infection. For example, it's been noted that the virus enters cells and infects cells through something called the ACE2 receptor. And we do know that the ACE2 receptor increases in its prevalence when you are on an ACE inhibitor or an ARB. That led people to ask the question, wow, should I stop taking those medications? And the answer is no. That's a biologic observation. There's no clinical data that would support that. And so we're studying it. We're trying to understand it, because there's an equally important part of the equation on the other side. We know that if people develop some of the severe symptoms of COVID infection, lung problems, breathing problems, heart muscle weakness, that those people have a potential benefit from ACE2 receptors. That in fact, people are looking at ACE2 as a potential therapeutic in people who have some of the most severe complications of COVID infection. So still a lot to learn, still a lot to try to understand, because the underlying risk of complications seems to be lung-based and cardiac-based, that we really do want to stress that people who have lung disease, including things like asthma, should take particular care of themselves. So a common question that we're asked is, when should I seek medical help? And it really has to, I would say the advice would be, it depends on your symptoms. If you have a temperature, some mild symptoms, little difficulty breathing perhaps, little short of breath, but it's not too bad, the advice would be contact your primary care doctor. Almost all systems, including our own, are widely utilizing video visits as a mechanism to do an initial assessment to try to understand, do you need to be tested for COVID infection? So for example, here at Stanford, we would have you screened through one of our primary care, express care video visits. You then a decision would be made to either take precautions, stay at home, self-isolate, try to take care of yourself at home. Or we might recommend that you go, for example, to one of our mobile testing sites where you can be tested from your car by a medical person who will swab your nose and try to obtain the material needed for a COVID-19 test. That is something that we're doing several hundred times a day here in the greater Bay Area. And this is very similar to what's happening, not just in our region, but across the country. So call your primary care physician. They will be able to first screen you and help to triage you to decide whether or not you should seek further attention. Now, if you have more severe symptoms, marked shortness of breath, chest pain, really severe symptoms, fever, it would be quite reasonable to seek help at an emergency medicine facility, letting people know that as you enter that facility, what your symptoms are so that you can be triaged rapidly and appropriately. And that might include COVID-19 testing. It may also include a period of observation while they await the results of those tests. Really important question is, what do you do if you're living with others and you have suspected infection? Self-isolation is recommended, though it can be very difficult in confined quarters, depending upon your family situation. If you can retreat to a certain part of the house, perhaps a spare bedroom or an area where not everybody is staying, do try to stay there. Try to take your meals there, try to rest, try to keep away from other people. Sometimes this isn't possible given the size of where one is being confined. But try to keep a distance. What we think the virus is most likely to be transmitted is that if you're closer than 6 feet apart for more than 10 minutes at a time. So we really try to encourage you to maintain that distance if you can't be in a separate room. We would also ask you to cough into your sleeve, into your elbow, so that you cover your mouth when that happens. Wash your hands regularly. Scrub surfaces that you touch. Let people know the surfaces that you've touched so that they can be disinfected and cleaned. It's really about good public health hygiene, washing your hands, cleaning surfaces, covering your mouth, staying away as much as possible from other people. It's very difficult to do. We all understand that. We all really enjoy our social interactions with friends and family. But please, let's try to keep everyone safe, even if one of us in the house happens to get sick. We're still trying to work out the course of the illness as we see the data coming in from places like China and Italy and New York City. And so we don't have the clearest picture yet of the course of the virus in everyone. We do know that there are people who get sick, feel better, and then have a subsequent deterioration in their health. A lot of that is felt to potentially be due to a heightened inflammatory state that accompanies the virus. And that's particularly problematic in people with chronic lung and heart disease. And so we do want to be particularly attentive to that. But a really important question is, how long could I be potentially at risk of infecting other people? What we do know is that if you're symptom-free, if you've tested positive and you're symptom-free for somewhere between 7 and 14 days, and we don't know the actual number of days that it takes to totally clear the virus, but we think somewhere in the 7 to 14 days after symptoms resolve is really the time period that you're most infected, most at risk of infecting other people. So please do try to prolong that self-isolation as long as humanly possible. These are unprecedented times. I've been a physician a long time, and we've never seen anything like this. This is something that we as a country are going to learn from, and I do believe we're going to emerge from this stronger as a country. But we have to get through it. We have to do our part. There's never been a time more than this when we really have to act together. We have to listen to the scientists, listen to the public health officials, listen to the clinical community about what the risks are. Let's follow the advice of social distancing and shelter at home. That's what looks most effective. It is hard to do, but we are going to emerge from this better off than we were before. We're going to go through some tough times, undoubtedly, but we're learning, for example, in medicine that there's a lot of things we can do differently. Telehealth, video visits, trying to really encourage people to reach out to those who are most vulnerable in ways that we hadn't before. So I do think that there's going to be some positive things to come out of this. We're going to certainly learn a lot scientifically, but we got to do this together. And that's my underlying message. Let's do this together. Stay safe, stay home, stay strong.
Thank you, Dr. Harrington, for sharing your wise words. And as you said, let's do this together.
Hi, I'm Congressman Eric Swalwell, and just like you, I'm at home during these very challenging and defining times. There's no question that these times are unlike any we've ever lived in, and what we do in the next couple of weeks will determine, one, how healthy we are as we come out of it, and two, how soon we come out of it. And that's really what's so important is, do we have the discipline as people to follow the guidelines when it comes to hygiene, washing our hands, staying home and not going unless it's for essentials like the grocery store, the pharmacy, or going to a doctor. If we do get sick, do we make sure that we call our doctor first rather than going in and sharing the symptoms with the doctor? If we do all of that, we can get out of this. But while we're in it, I think it's important that we do not socially distance ourselves from each other, that we physically distance ourselves, that we find new inventive ways to stay in touch with our friends, our family, and people that we care about so much. Get to know your neighbors, even if it means you have to yell across the street to talk to them. Get to know family members by checking in on FaceTime or text message. I'm finding new ways ourselves. We're having, card nights with our friends. We have a friend that just invited us to a bingo game this week. So we're doing it all to try and, just stay sane throughout these difficult times. But it's also important because most of us have members who are in their own health battles separate from COVID-19. I have a family member undergoing cancer treatments right now. And as much as I would like to be with her, as hard as it is to not see her, I know that the best thing for her is that I and others do not go near her. It's really people with chronic illnesses, with challenged respiratory systems, and cancer patients who could be hit the hardest if they are exposed to COVID-19. But they still need us, and the people taking care of them still need us. So I'm continuing to check in with them as much as possible. But again, I know who we are as people. We can get through this. This is what we do. We just put our heads down, the shoulder to the wheel, and we make sure that at the end, we're all healthier and we pick ourselves up. While it's frustrating to think about what this has done to our health and our economy, there is some fulfillment in knowing that we're all in this together. If you're suffering, I'm suffering. If your neighbor's suffering, that means everyone on the block is suffering. So there's some solidarity in knowing we're going through this together. It's hard together, but it's going to be really sweet that day where we can all come outside again, talk to each other, hang out with each other, embrace each other, and hug each other again. I look forward to doing that, and I know we all have the discipline to get to that day.
And now please join me in welcoming Dr. Patrice Harris, the President of the American Medical Association. Dr. Harris has diverse experience as a practicing physician, a public health administrator, a patient advocate, and a medical society lobbyist. With that, Dr. Harris.
Greetings. On behalf of the American Medical Association, I am so honored to be with you today. I am Dr. Patrice Harris. I'm a psychiatrist here in the Atlanta, Georgia area. And I am practicing self-care, as I hope all of you are, as we weather the storm of this pandemic. COVID-19 has upended our lives in profound ways and unfortunately will continue to do so for the foreseeable future. Not only has this pandemic put tremendous strain on our front line, on our medical workforce and our health system, but residents in almost every city and every community. And so even though we're not able to meet in the same room, I appreciate that we're able to gather virtually to talk through some of the most common questions I've been receiving over the last month and to highlight some of the steps each and every one of us can take to protect ourselves, our families, and others that we care about. At a time when disinformation about this virus is rampant online and across social media, knowing the facts is critical. So I'd like to begin the conversation by identifying the basic but critically important facts about coronavirus and how it spreads. So here's what we know. COVID-19 is a new respiratory illness to which people are not yet immune. People infected with COVID-19 may have very mild symptoms or actually none at all, or they may have very severe symptoms similar to pneumonia with respiratory failure, that means our lungs failing, and septic shock. So I want to be clear, anyone at any age can become infected with COVID-19. But those at greatest risk of infection are persons who have had prolonged contact with someone who has COVID-19 and those who live in or have recently been to areas with sustained transmission. It's important to know that because this is a new illness, we have limited data about who is most at risk or how long a person can transmit the disease. However, from the data that we do have available, we believe that older adults and persons who have underlying chronic medical conditions such as diabetes, hypertension, and obesity may be at risk for more severe outcomes. The incubation period for the disease is thought to be from 2 to 14 days. And that's why you see requirements that people self-quarantine for 2 weeks when they've been in contact with someone with the virus. Now, we know now that the virus can be transmitted even when a person is not showing any symptoms. So with that as our starting point, I'd like to offer some practical tips on how we can minimize our risk of exposure to COVID-19. First of all, and this is basic, but be diligent about washing your hands with warm soapy water for at least 20 seconds. Cover your cough and sneeze. Wash your hands immediately after. The CDC has recommended everyone wear a face covering. Please avoid touching your eyes, nose, and mouth. And clean and disinfect frequently touched household objects or surfaces with a household disinfectant or wipe. Most importantly, everyone stay home. And let's call this physical distancing. I know people talk about social distancing, but I like to use physical distancing. But during this time where we have to remain 6 feet apart, and where we aren't going out except for groceries or medical issues, I urge everyone to stay connected. If, of course, you have symptoms and need to be seen by a doctor, call your physician's office or hospital in advance so that they can be prepared. One of the things many of my colleagues are doing is using telemedicine. That's connecting with patients, either video conferencing or even over the phone. One of the things I want everyone to know that it is okay to be fearful at a time like this, but remember, you're not powerless to protect yourself from this virus. There are steps you can take to minimize your personal risk, and I've outlined those already. Again, as a psychiatrist, I want to point out the importance of identifying and addressing the emotional and mental health aspects of this pandemic. And please, as I started my remarks, attend to your self-care and all of your health needs during this challenging time. I recently wrote an op-ed that was published in USA Today that highlighted 7 tips for dealing with the uncertainty and social disruption we are all facing right now. So first, experience your feelings. It's normal, again, to feel afraid and to worry during a major health emergency, but channel that worry into action. Create a safety action plan. Implement the health and safety tips we've talked about. Again, stay home. Can't emphasize that enough. Physical distancing, wash your hands, don't touch your face, and avoid those who are sick. And if you're sick, avoid others as well. Get your body moving. You don't have to have a fancy exercise routine. Just put on your favorite song and dance. Take breaks from news and social media. The constant stream of breaking news in our current medical and social media environment can add layers of stress on top of everything else we're experiencing. Again, stay connected to family and friends. You can pick up the phone, email, and of course, use social media. Routines are disrupted, so develop new routines. Lead by example. Show those around you, your children, family, neighbors, and community, how to follow the guidelines while still maintaining your health and well-being. Let's remember to be kind to one another and to reach out to others who might need help. If you have a neighbor, an elderly neighbor who can't shop for that neighbor. Now, I want to make sure that we appreciate that this virus does not discriminate. Prince Charles of England has been infected. Kevin Durant, an NBA player, has been infected. Physicians and nurses, members of our military at home and abroad, the homeless, people of all races, ages, and income levels. While anyone can become infected, older adults and those with chronic conditions and compromised immune systems are at higher risk of some of the more serious complications, including death. And although we still need more data to better understand the full scope of this pandemic and which communities and why those communities are bearing the brunt of these infections, we want to make sure that we get the data regarding communities of color and low-income communities, because many of these communities were already suffering from health inequities. We know that many people battling chronic conditions may also have non-medical concerns that are barriers to getting the care that they need, such as inadequate insurance coverage, access to transportation to get medicine and groceries, and newfound responsibilities for childcare now that public and private schools are closed across the country. So people may have all kinds of unmet needs and require assistance from family, close friends, or a neighbor. And that's why it is, again, so important to continue making those social connections. Again, we sometimes forget that at the very least, we can pick up the phone. And I've heard a lot of folks are calling one another as opposed to texting, which I think is another way to make sure we maintain that connection. Certainly follow the guidelines of your local and state public health departments. Many of them have numbers to call if you need help. And I'd like to also finally talk about how we can all stay up to date on the latest information and why it's important to make sure we have accurate information. Misinformation is rampant, and we want to make sure that we are looking to credible sources of information, the CDC, the NIH, the Journal of the American Medical Association, and your physician, your own personal physician. We all must make sure that we do not contribute to the spreading of misinformation and falsehoods online. So let's all be discerning news consumers and only share information from credible sources. Let's follow the science and not just something a friend posted on Facebook or Twitter. You know, I realize this is the first time many of us have faced such a significant health challenge, but we will get through this together. In closing, I'd like to give my most heartfelt thank you to all of the physicians and the nurses and other health professionals who are so heroically fighting this pandemic. I'd also like to thank those who are cleaning exam rooms and offices and medical facilities and cooking and delivering food. I know, again, all of us working together, we are in good hands. And I'd like to thank everyone who is committed to doing your part. Individual actions make collective impact to physically distance so we can slow and even prevent the spread of COVID-19. Thank you.
Thank you, Dr. Harris. Your warmth and your wisdom and your words of encouragement are needed by all.
My name is Kelly and I'm a registered nurse. I know these are difficult times, but every day that you stay home and practice social distancing, you are preventing the spread of COVID-19. Thank you for staying home, for taking care of yourself, for taking care of your families, and for making a difference. We will get through this together. Stay strong and stay safe.
Now I'd like to introduce our own Livongo behavioral health expert, Dr. Julia Hoffman. Formerly with the Department of Veterans Affairs, Dr. Hoffman has been called into action throughout this crisis by the state of California. Dr. Hoffman?
Thanks so much, Courtney. This is Julia Hoffman. I'm a doctor of clinical psychology and Livongo's vice president of behavioral health strategy. I'm sheltering in place here in my home in San Jose, California, right in the heart of the Silicon Valley, with my 2 children, a 4-year-old and an 8-year-old, my dog, Winnie, who is a senior citizen dog and less interested in having us all home than you might imagine, and my husband, currently working from home software kind of a guy. So around here, in order to keep ourselves safe and healthy, we're doing all the regular stuff that's been recommended by experts in the field, washing our hands constantly. We're leaving packages outside for a little while before we bring them inside. We're limiting our trips outside other than to get some exercise and some air here and there. And generally trying to stay connected to other people via email, video chat, regular chat, video game chat, all kinds of chat, basically. We're the chat household at this point. So interestingly, although this is a medical pandemic, really most of the problems that we're currently seeing are mental health related. Because those of us who aren't yet sick or who may never get sick, hopefully, are living with the reality of people around us who are compromised, getting sick, living with being stuck in small quarters, which isn't great for people, without our usual human-to-human interactions, without the structure of our daily lives. A lot of people are really struggling, feeling the impacts of just feeling unmoored or unconnected from their lives and from their routines, or feeling lonely, the kind of intense loneliness that actually has really big repercussions, both emotional and even physical. And so these issues around the anxiety of what's coming next, the lack of clarity around when this whole situation is going to end and how we can get back to normal, if we can get back to normal, is really weighing on all of us at this point. And so although we have not seen an increase in traffic in mental health clinics, obviously, since nobody's going out, we have seen a massive increase in the use of remote mental health services. So that includes things like digital tools, like the ones that we build at Livongo, including our MyStrength platform for behavioral health, and also remote or tele services with licensed care providers as well. So people are reaching out for care from professionals, for care from digital options, and then additionally for support from loved and trusted people in their own lives. So for people who are at home, who are experiencing the same stress as all the rest of us, even the best trained among us are experiencing a lot of stress at this point. Really, the key thing to focus on is the difference between things that you can change and things that you can't change. Even in AA, although this is not only specific to alcohol or substance use, there's a prayer that's used all the time called the Serenity Prayer. It doesn't have to be religious, but it talks about the fact that there are things that we can accept, there are things that we can change, and we have to have the wisdom to know the difference between those. So there are some examples of things that you cannot change, include you may not be able to see your elderly friends and family right now. You may not be able to go to the things that usually keep you feeling like yourself, whether that's an exercise class or a workplace or coffee with friends. And then there are some things that we actually can change. And I really recommend that people focus on those. You can change your own internal state. You can change your own way of thinking about the situation. You can focus on gratitude. If you are healthy and most or all of the people that you love are currently healthy, that's an incredibly powerful thing to focus on. And really looking for opportunities to engage with your environment in new ways can be very, very powerful. So looking for opportunities to contribute. That's one of the things that we find is actually the most valuable in times of stress, is if you find a way to be helpful to other people, that can go a long way towards managing your own mood. I think that taking a really solid look at how things are or are not working in your home environment, especially if you're going to be stuck in your spot for a while, as we are here, is important. So understanding what's working here, what's not working. It was not working for my children to homeschool themselves, certainly not my 4-year-old. And so now my husband and I are taking turns. For example, we've just had to reorganize ourselves in order to accommodate that reality. So some pieces of managing your stress are just looking at logistics and trying to take a realistic view of what can be changed and how you can actually identify what things are stressing you out and then do something differently, right? And then there are a whole bunch of things that we just cannot do much about. And so it's more a matter of saying, this is temporary. I can get through this. I used to recommend to my patients that everybody should have a mantra. Everybody should have something that they say to themselves that means something to you that you can pull out that essentially has the theme, I can do this. This is hard and I can do this. And I can share mine, which is I always think of myself as a boxer. I say to myself, I can go another round. I can go another round. It doesn't say I can go infinity rounds. It doesn't say this isn't horrible and I'm not getting beaten up, because certainly in this situation, I feel as beaten up as everybody else, I think. But then I'm not giving in just yet. And so I highly recommend, you can steal mine if it helps you, but I highly recommend that you have something that you can say to yourself that will say, this situation will pass and I can do this. I can get through one challenging moment and into the next. So one of the questions that we're getting asked a lot is how to differentiate between the chest pains and the shortness of breath that comes from COVID-19 versus that comes from a panic attack. There's obviously not an absolute way to know the difference. And if you feel like you are in any kind of danger, then you need to seek medical attention. I will say that if you haven't had illness leading up to the shortness of breath, that most likely what you're experiencing is anxiety related. So the COVID shortness of breath does not tend to come out of thin air. It is related to the underlying illness. So if you're finding that you're just sitting around and thinking about the challenges that we all have in the world right now, or that you personally are experiencing due to COVID-19, what you may be experiencing is a panic attack. One of the things that you can do pretty easily to check is to do your absolute best to slow your breathing. So if you can pick a pace, it doesn't have to be deep breathing. That may not be available to you if you're having a panic attack. You may not be able to breathe from down here in your diaphragm. But if you can pick a pace and just breathe in, 2, 3, 4, and hold, 2, 3, 4, and then breathe out, 2, 3, 4, and do that 4 to 6 times. If you find that you're starting to feel better and the symptoms are starting to reduce from doing that, then most likely what you're looking at is anxiety. And you can make a habit of doing those kinds of paced breathing exercises throughout the course of your day. What we find with people with anxiety is that they breathe either too much or not enough. And so what you may find is that you gasp for air after waiting for a few minutes or a few seconds, hopefully not minutes, of holding your breath without realizing it. So monitoring and maintaining a steady flow of oxygen and sort of maintaining the internal rhythm of your body can be very, very helpful. My advice to parents is to give yourselves a break. Understand that if things are different now, if rules are out the window in some cases, if there are more treats or screens or snuggles or waking you up in the middle of the night or whatever is going on, given the size of your children, you may just have to accept that and give a little bit of grace, because we're all dealing with this in the age-appropriate ways as best we can. So if people are looking for ways to cope while they're spending their time at home, I do have a couple of recommendations. I think the very first one is your trusty old phone, tablet, PC, whatever you've got. Make sure that you're staying in contact with the people that matter to you. Even if you don't feel like staying in contact, practice, instead of saying, I'm fine, saying how you actually feel. Think about it ahead of time. If what you feel, let me think how I feel right now. I would say I feel existentially exhausted. If somebody asked me right now how I felt, I think I would say I feel existentially exhausted, but also comparatively, I'm fine. I'm healthy. Everybody that I care about right now seems to be healthy. But look for those ways to connect and try to connect in real, honest and authentic ways every single day, using the tools that you already use to reach out to other people in your lives. And then beyond that, if you need professional help, there are telehealth options, there are direct-to-consumer apps that you can find that can be really helpful. And there are many, many licensed and unlicensed providers standing by to help you to navigate whatever kind of stressors you're up against right now. We are delighted to help. This is what we've trained for all of our lives. Additionally, Livongo offers our behavioral health platform, which is called My Strength, which is on the web. It can also be used on a tablet. We have native mobile apps for the 2 different platforms. And you can use that platform to navigate through managing stress. It gives you interactive activities for managing your stress, anxiety, for managing grief, which unfortunately is going to be coming up for more and more people soon, for navigating the complexities of relationships, especially in the time of COVID, where people with new relationships, people with old relationships who are learning new things about their partners can be challenging. So most of us have never been exposed for quite this long to our partners all at once. How to navigate those complicated conversations with your children is all covered on the new COVID resources that we launched on the My Strength platform. So a lot of people are finding it really challenging to navigate their romantic or even roommate relationships at this time. Relationships with other adults can become really complicated when you're stuck in a small space. I'm reminded of where I started in my career, which was when I was first building digital interventions for folks that they would use remotely. We were trained by NASA astronauts, we were trained by NASA scientists who had been building remote therapy for astronauts for years, because it turns out when space missions fail, it's almost always because of interpersonal problems between astronauts. And when I think of how smart astronauts are with their multiple doctorates in many cases and decades of training, it turns out that being stuck in a very small amount of space together will get to even the best among us. So that's never seemed more applicable than right now. We are all stuck, some of us at home alone, which is also challenging. And I'll talk about that in a second. but some of us with ones that we usually really love and appreciate and are finding that dose makes a big difference. So too big of a dose of a good thing can still be somewhat challenging. I do have a couple of recommendations there. So the first is to really consciously give each other space. You cannot be in another person's face for 24 hours a day or however many waking hours you've got a day and expect to both maintain your sanity, no matter how much you love that person. So planning, even if it's just to be on opposite sides of the room, and quiet with headphones on, can be really, really important. Treating your spouse or partner or roommate like a coworker, where occasionally you may have to put on those headphones and just lock yourself into your own private world for a little bit, is important. Another piece is to give each other the benefit of the doubt. Everything is more annoying than usual right now. That is absolutely expectable. We all live on a sort of a normal curve of stress. We're at the low end of the curve. If we're under stressed, we don't do a lot, we're feeling kind of lazy, we're underburdened. At the high end of the curve, we're burnt out, we're overstressed, we can't handle anything else. And so what ends up happening are minor offenses can be like rubbing a feather across a bruise. And we end up sort of overreacting just because of where we are on our own stress curve. Make sure that before you overreact, you try very hard to take a deep breath, count to 10, take a step back, decide how important it is to go to the mat over any given thing if you have the mental space in order to do that. If you don't, then just get really good at apologizing, because we all have to live together through this whole thing. I honestly and truly believe that many of us are going to come out of this with skills that we didn't have before, just out of necessity, because that's how emergencies work. I want to say a word to the folks who are home alone. I think that the reality is that loneliness has really deep impacts, both emotionally and physically. So we know that profound and continued loneliness can have the same effect on your body as smoking 15 cigarettes a day. It can impact heart disease, strokes, etc. And so it really is important and not at all a superficial issue. If you are feeling fine by yourself, that's great. You should still endeavor to interact with people in a meaningful and personal way at least once. Even better would be twice or 3 times per day. So that's not, if you're working from home, going to Zoom meetings or just engaging with others through the course of the have-tos of your day, but more very specifically making time for engaging and talking about yourself and what's going on with you, or deeply listening to what's going on with someone else. No, it's okay. You can come in. Hi. Do you want to say hi? You want to say what
Hi.
You want to say what your name is?
Hi, my name is Vivi, and
Do you want to say anything about why are we home right now?
because of the sickness.
Yeah, because of the sickness that's out there. We have to stay safe, right? Yeah. Good luck out there, everybody. Take good care of yourselves. Do whatever it is that it takes to make you feel safe and sane and happy as possible during this period. Wear whatever inspires you. Do something physical with your body and connect with other people every single day. And we'll see you on the other side of this. Bye. You want to say bye?
Bye.
Dr. Hoffman, thank you. I loved what you said about going another round. And I agree, we got this. And clearly, as seen by your daughter, I'm so glad that someone is still dressing up during this shelter-in-place pandemic. Our Livongo coaches support members 24 hours a day, 7 days a week, with phone calls and text messages as necessary. Today, Kelly Godino joins us to share some useful tips on staying healthy, active, and happy during COVID-19.
Thank you, Courtney. My name is Kelly, as you mentioned, and I am sheltering in place here at home in Wilmington, Delaware, with my husband, who is now also working from home, which is an adventure. So we are trying to find opportunities to get some of that energy out, whereas we used to spend time in our community and go out to eat or go to the local gardens. We're now having to find ways to get that energy out, and also going to the grocery store is more of an adventure. So we're trying to do that less often and do more cooking at home. Honestly, I'm a bit of a stress baker, so I've got lots of delicious sweet treats at home now. So we're finding new ways to still keep routines that are really important to us, like sleep, and trying new skills, really cultivating meditation and yoga routines. And like I said, some more cooking involved. And really the biggest thing that's been helpful for us is because we are in an area where we can get outside and go for a walk at a safe distance from others. That's been crucial for us, getting out every day to get some fresh air, get some sunshine, and move around a little bit. As far as how do we stay healthy at home? Well, first we stay home, right? That's for the best of all of us. But a lot of members I've been speaking with, the common challenges might be, how do I handle stress eating? I hear you, it's a thing, you're not alone. And how do I keep moving? So as far as the stress eating goes, we've got lots of tips here. One thing to keep in mind is that we're very visual eaters. So you can really plan ahead and set up your kitchen for success. One of those is putting the healthy options out and in a more visual space, because we're more likely to grab those things, and put those things that maybe don't make you feel great when you have them, put those out of sight. So you're more intentional about when you go for those. Some folks like putting up even a yield sign or some sort of visual reminder on their pantry or fridge that helps them pause and say, wait a second, why am I here in the pantry or at the fridge? Am I truly physically hungry, or do I have something else going on, right? Like stress or boredom. And it helps you pause and ask that question. So both having those healthy options, our go-to tip with snacks and is putting together protein and produce at the same time. While we have less accessibility to fresh items, we may have to get creative with that. So that might be, frozen veggies or even canned veggies, or dried fruit, and then adding that with some sort of protein source. The beauty of this is you can get creative with that too. It can be whatever your favorites are. So right now I'm still able to get a hold of fresh apples. So pairing that with a spoonful of peanut butter, that's one of my favorite go-tos, or like Greek yogurt with some frozen berries, right? That's another way to integrate. That's gonna have a longer shelf life there. So reaching for those healthy options. And then what do we do when it's that mental hunger, right? Where we're hungering for addressing that boredom or that stress. One tip with that is what we call name it to tame it, right? So it's with that yield sign, having that moment where you pause and you ask yourself, what's really going on right now? What do I really need? And sometimes even naming that out loud helps you say, hey, Kelly, this is stress eating. How can I address this stress with something that's not food? Because I know that food won't actually take away that stress. And that's where it's really key to have some structure and routine. This has really been key. So having some sort of breaks incorporated into your day where you're doing, taking a break from the work and the chaos that may be going on for you, and even just taking a breath or going for a walk if you can, even if it's around in circles in your house, or turning on some music, scheduling those breaks and those things that you love to do, and having that list of things that you like to do that brings you that sense of relief. For some people that's doing something more active. For some folks that's meditation, breathing, reading a good book, calling a friend or family member. That sense of connection is really important right now. So one thing with those hunger cues that are coming up is thinking about, when do you typically eat a meal and snack in your regular day? For some people that might usually take their lunch to work, maybe go ahead and pack it for work and just leave it in your fridge so you know, hey, that's what I'm going to go to. That's what I'm going to have today. And whether you're writing out or putting on alarms at your typical eating times, to remind you that if it's not that typical time, it's an invitation to ask yourself, am I truly hungry right now? And then go back to using those tools we talked about with managing stress. Thank you for this opportunity to be a part of this, and I really appreciate being able to be here with you all.
Thank you for sharing your time with us today, Kelly. It's so good to see your smile.
Hello, I'm Eric Hargan, the Deputy Secretary of Health and Human Services. As Deputy Secretary of HHS, I serve as the Chief Operating Officer of the department and help to coordinate efforts among the many parts of HHS that are contributing to the response. The scientists at NIH working on research to help cure the disease, the scientists at FDA working with private industry to develop new products, public health professionals at CDC, our colleagues who run the Centers for Medicare and Medicaid Services, our big insurer enterprise, and so many more. As you can see, because so many members of the HHS family are working to support our war on the coronavirus, it's been essential for me to keep coming into the office every day. But even in doing so, we've been sure to practice social distancing, avoiding in-person meetings wherever possible, practicing good hygiene, and the like. Much of our work at HHS goes towards supporting those on the front lines, the heroic healthcare workers that so many of us have been inspired by, and I want now to thank them for their service in particular. As all of you know, as a country, we remain under the national social distancing guidelines that the President and his task force have extended to April 30th, at the recommendation of our top public health leaders at HHS. Your state and local governments will likely have issued more detailed guidelines or formal restrictions on business and social activities, so please pay attention to them as they update these policies in response to the evolving situation in your area. Now, since we're hosted by Livongo today, I want to offer a special thank you to American business leaders and innovators who have played a role in our response so far. American ingenuity is not only going to help save lives here, it is going to make it possible for the entire world to turn the tide on the virus. In the United States alone, over 20 diagnostics have been approved, 10 different potential COVID-19 therapeutics are in active trials, and another 15 are in plans for beginning trials. We've also seen all kinds of other innovations, including new ways to use telehealth and to track health outcomes, some made possible by regulatory flexibilities offered by HHS. Every American can get creative about their role in this all of America response. So please continue to stay safe by practicing social distancing and think about what you can do to pitch in. That may mean helping to organize to support healthcare workers or the elderly in your community, or it may mean thinking about how a business you run may be able to support the response. Whatever it is, we at HHS and across the Trump administration are here to help. If there is some government policy barrier that might be getting in the way of your work to respond and to help, please let us know. We are deeply grateful for every American's patriotic, generous response. Thank you for inviting me to share a message. Stay safe, stay healthy, and keep working to slow the spread.
We've now heard from a variety of speakers, all with practical tips. We thank you for sharing of yourselves, of your homes and your families, and how you've stayed resilient during these challenging times. I'm honored to now introduce Dr. Jennifer Schneider, our Livongo president, a physician, a mother of 3, and a person living with type 1 diabetes, who's going to share some exciting news with all of you. A warm welcome to Dr. Schneider.
Thank you, Courtney. I'm Jennifer Schneider. I'm the president of Livongo. I live in St. Helena, California. I'm the mother of 3 children. Each child has their own guinea pig, as seen here. We're also in a house with 2 cats and 1 dog. We're in a nice rural area, which allows us to get outside, allows me to run every day, and allows the kids to get on their bike and do some laps and take off some steam. So we're really fortunate in that sense. Staying healthy as someone who's living with type 1 diabetes has been a little bit more challenging than usual. More challenging because there's less activity moment by moment, and certainly more food and a little bit more stress and anxiety. So the things that I'm doing are to ensure that I get out for a long run every day, ensure that we're having fresh vegetables and fruits in the house all the time, and make sure that I'm having a little bit of time to myself. Typically I disappear late at night to do a Peloton ride, just sort of carving out a little bit of time. As much as I love my children and love getting to be their teacher while working, it is a lot. And so just making sure that I'm focusing on those three things every day. So on the home front, I've now entered into being a first, third, and fifth grade teacher in parallel to my day job. We at Livongo have had a really great culture of working remotely and have a number of our employees have been doing this. About a third have been doing this from the get-go of the company. And so we're set up to do that very well. The work that we're doing at Livongo is incredibly important because we're doing remote monitoring for the most vulnerable populations, those of us living with diabetes, people with hypertension, weight management, and behavioral health. And so it's really important that we've enabled and continue to allow our employees to work from home in the setting of this COVID-19 pandemic, again, particularly because we're taking care of that vulnerable population. We have a very accepting culture, and that, as you saw, all three of my children and all of their guinea pigs, they often make frequent visits, and it has become somewhat delightful, a little distracting, but overall we've been able to remain highly productive in the setting of the changes. People who are at risk for serious infections of COVID-19, and actually all people, should remain and adhere to the CDC recommendations. The recommendations are very clear around physical distancing, not social distancing per se, meaning you should keep social contact, but ensure that you have physical distance, at least 6 feet apart from other individuals. There's now a recommendation out around wearing masks when you're unable to keep the 6 feet away. I think all of us need to adhere to those. The infection rates will continue to decrease. For those of us who are especially vulnerable, and that includes populations of people with diabetes and hypertension, ensure that you have the resources and the medications you need at home and are tapped into your healthcare professionals, whether that be through the certified diabetes educators at Livongo or telehealth providers. It's important that you maintain control of your conditions, particularly in this setting. Staying connected remains incredibly important right now, particularly because we don't have those day-to-day interactions. Some of the things that we've been doing, I'm sure as many others have been leveraging and using the virtual connections, whether that be Skype or Zoom. My kids, for example, take all their music lessons with their music teacher, and that's been really fun vis-a-vis Zoom. Other components are writing letters, a return to the old school of letter writing. My children and their friends have taken to writing letters, and it's a wonderful skill. Not only do they learn how to address the envelope, but it really feels like you can hold and treasure those letters in a way that you can't with some of the virtual conferences. So in many ways and aspects, there's a really big benefit to slowing down and doing things slightly differently. As you heard earlier from Dr. Julia Hoffman, we're really excited and proud to launch the COVID-19 Mental Health Wellness. These are resources, 15 modules of resources that are designed specifically to assist people in coping with COVID-19 during this pandemic time. These are made available nationwide to all people who could use the resources. You can find them at livongo.com. Livongo is here for you, and we've opened up a resource for all people with chronic conditions to support in the time of the need, and that's available on our website. I want to give a hearty thank you to Sean DaCosta, Tracy Brown, Dr. Patrice Harris, Dr. Bob Harrington, and our congresspeople for making and presenting on our webinar today. I also want to thank our internal Livongo producers and speakers. Thank you. We are all in this together. We can do our best by following guidelines, listening to advice, and helping one another. We will come out of this together, stronger.